Good afternoon. I'm Dr. Sandra Martel, the Public Health Administrator for Winnebago County, and today I am joined by the Mayor of the City of Rockford, Tom McNamara. So as we kind of look at where we are, a couple of weeks into our new phase, again, I'm going to kind of come back with some themes. Move it outdoors. A Japanese study estimated the risk of catching coronavirus is 20 times higher indoors than out of doors. A review of over 7,000 cases in China documented only one case of outdoor transmission. Wearing a mask further reduces the risk if you're socializing with members who are not in your household and you're outside. But think outdoors with distancing. Remember to apply your sunscreen, hydrate with water, and use mosquito repellent. Reported our first positive bird for West Nile virus. And so while it's a great time to get out of doors, we still are at risk for health and concerns and issues regarding the heat illness, heat stroke, West Nile virus, which all increase during the summer months. But whenever you can, and I mean this, move it outdoors. So if you're planning to get together with family, move it outdoors. Planning to get together with a couple of friends, move it outdoors. Planning to dine out, move it outdoors. Planning to have a cocktail with some friends, move it outdoors. The other thing that's probably happening a lot with many of our businesses and establishments is people want to get away and make summer travel plans, right? So we talked about this a couple of weeks ago now, but again, we know the city of Chicago's issued some travel bans, but I've got to talk to you as the public, as concerned residents and citizens of Winnebago County about using some common sense on this. Avoiding travel to areas or having visitors from areas of high rates of infection, including but not limited to Alabama, Arkansas, Arizona, California, Florida, Georgia, Idaho, Louisiana, Mississippi, North Carolina, Nevada, South Carolina, Tennessee, Texas, and Utah. Now this list can change because disease rates are spreading throughout the country. And what's common about all these states is not that they aren't lovely and great places to visit, and we don't have family that might live there, and we may want to see them. And maybe it's even to visit new college campuses. But these are communities and states where the infection rate is rising higher than ours. And so we have to be thoughtful about that. Travelers from these states are directed to self-quarantine for 14 days from the time of their last contact with either someone traveling in from that state or traveling out of that state. So remember that. It's a choice, but understand what the ramifications are. And we talked about this the last time. The only tools we have left are things like masking, hand washing, social distancing. And what we don't want to have to do is like so many of the states are having to do, which is move backwards, which is I call the rollback. Rolling back, closing things. We certainly don't want to go into sheltering inside during our beautiful summer months here because the infection rates have risen. Testing is also another kind of subject matter that's out there. Winnebago County still has 2 community-based testing sites. Auburn, operated by Crusader Community Health, and they plan to continue to operate, but they are making plans to move that to a different location as school resumes. And the University of Illinois Health Sciences campus. And while that was run by the Illinois National Guard as part of the state transition, has gone to a private contractor, but they are using the same lab, the same locations, a little bit different testing methodology in that there is a healthcare provider that takes your sample rather than self-administered in your car, but it is a drive-up site. But I want to caution, I hear people saying that their businesses are sending them there. This is a point-in-time test. So being negative today doesn't mean that you will stay negative if you continue to have exposures, or if you were exposed 2 days ago. The incubation period is still 14 days. That hasn't shortened. Employers and individuals should not take it upon themselves to determine if they are safe to return to work or break isolation or quarantine. I often hear from an employer, well, they tested negative, they can come back, right? Let the health department do its job. We are the experts on this about bringing individuals back. People that are symptomatic still need to stay home. People that have been still in that incubation period still need to stay out of the public because they can unknowingly transmit the virus. And the decision is based on symptoms, exposures, household members, oftentimes as employers, or we don't know all of the details of that person's household living arrangements, nor should we. But we as the health department work with them to determine what's the safest and most effective way to bring them back safely so they don't get sick or expose others, and more importantly, that they don't expose their household members as well. Because we all have a dual responsibility to not only to our businesses or employers, but our households, and those that are vulnerable in our households. So I ask the community, again, do not take it upon yourself to make health recommendations. That is the role of the health department. Let us be your public health expert, and we will provide you the best guidance to protect your health and your livelihoods. I've been working with, over my break, was reading up on the regional school information, joint guidance issued by both the Illinois State Board of Education and the Illinois Department of Public Health for return to classroom instruction in the fall. There are things that are going to stay the same. Routine vaccinations and physical exams per school code will continue to be required. So this is a great time. Healthcare systems are able, open, and ready. They're COVID. They know how to handle this. So schedule those appointments now because they've taken all the necessary precautions. Schedule your household members together. That helps the healthcare system to know. So if you, your family members are coming in for your preventive care, get it all together and wear your mask. We want to make sure that you also, as the time marches on, you'll start to see, we'll begin to receive seasonal influenza vaccine. And so this becomes as critical as any other time in our history is to be vaccinated against seasonal influenza. But I want to caution, so while you're preparing as if it's going to be a normal start, everyone's getting their school physicals, their vaccinations, are already back, your eye exams, it will not be school as usual from a public health perspective. Masks, face shields are going to be the norm in our public school systems and our private school systems. You'll hear a lot about blending of in-person and remote learning, so that allows for them to socially distance the classroom. It also prepares that so if they have to roll back and move children out of a school environment, that they are ready to continue their learning in that remote perspective, and the teachers are ready as well with them. School calendars may have to be adjusted. You're hearing about a lot of the universities are doing different calendars, starting maybe earlier, ending around the Thanksgiving break. You might start seeing that we are not going to have as many breaks like a mid-October break that you often saw in the school calendars. Because again, the idea being if things are going well, we don't want to have to go shifting back and forth during peak flu season as well. There will be probably limitations on extracurricular activities. We're already seeing some of the Illinois High School Athletics Association issuing some guidance regarding how much competition, what kind of contact sports will be allowed and permitted, what will those kind of team plays, how many people will be allowed to observe. You'll start to see increasing cohorting of teachers and students. So classroom, think of those of us who went to big high schools and what that classroom bell sounded like when we all gathered in the hall and we moved and we went all over. That is going to be very different if we're going to take this seriously because the number of contacts and exposures is very high in that kind of a situation. And for those of us who remember the old days of homeroom, we might be staying in our classroom and our teachers rotating. So every school, every teacher, every principal, every superintendent is looking at how do we bring back children safely, back into a learning environment that promotes their social, emotional, and really their educational attainment goals. Medically fragile and vulnerable students may have to receive more home instruction. It may be the situation if our cases increase that it's too dangerous to bring them into classroom. And so how will we make sure that they receive equitable education in those circumstances with support to their families? And for those of you who remember cafeteria days, I am sure our lunch periods will look very, very different from those of us who used to do the en masse. Did you have the early, the late? How many kids would process through a cafeteria and quickly get their lunches? When I think of how many meals Rockford Public Schools does a day, our restaurants don't do that pace. And so how will we be able to do that effectively? And parents or guardians are going to need to be prepared if an outbreak results in school closure, which means that they may not be able to go to work. And so what will that mean? And again, I remind families, this will not be the time, for those of us who remember as well, I don't know. My mom used to say, you'll feel better if you went to school, right? This will not allow us to send our kids back to school. If they are not feeling well, they must stay home, and you, the parent or guardian, must stay with them. There's too much risk of exposure to those around. I've been asked to speak about blood donations as well. And while we're going through a pandemic, and I've told you some reminders about how to stay safe when you're out of doors, there continues to be an ongoing national severe shortage of blood during this pandemic. As you would guess, people who took the information seriously stayed home, but we do need blood donation. Healthy, eligible blood donors should consider donating. Again, the blood donation centers are ready and prepared to be able to manage and coexist with COVID-19. But think about some of the health benefits to a blood donation. It reduces iron level in the blood, reducing cancer risk. It maintains healthy liver and heart. For those of you who are regular donors, this could be a way to lose your pandemic pounds. There is weight loss with regular donations. It stimulates blood cell production, and it saves lives. So with all the other masking that you're doing, all the other preventive, 1 pint of blood can save up to 3 lives. So again, I remind our population to contact the American Red Cross or the Rock River Valley Blood Center to donate, to schedule an appointment. They are prepared and ready to receive you. And all facilities will protect donors against COVID-19. But we need people to donate. So here's the daily numbers. Our new cases today were 55. So for those of you who've been tracking the numbers, that's a significant increase. Cases were between the ages of 2 and 74 years of age. Our total case count now is 3,189. Our total negatives, approximately 35, almost 36,000. So when you think of our population, we've tested over 10% of our population. The good news, though, is our positivity rate continues to decline. We're at 2.9% for a rolling 5-day average, but our overall positivity rate is 8%. We have no additional deaths to report. Our current death rate is holding at 99 total deaths, and 96% has been reflected in our recovery rate. We are reporting some new locations of concern, Mosaic, and I'm unable to tell you the specific location due to the group home sizes for there. Rosegrant's Griffin Williamson campus has had their second, they're back on the list, and Carriage Rehab and Healthcare. But the good news is some of our long-term and congregate care facilities have come off, meaning they've met 2 incubation periods without any new infection or symptoms of COVID-19, and that includes Onum Care, Milestone, Stepping Stones, the Atrium, and Wesley Willows. So I want to applaud those staffs that have worked so hard and so diligently, along with the residents who've done what they needed to do to keep their infection rates low and to not have any additional cases over 28 days. And for those of you who've been watching the news, you know that that is very difficult. So with that, I want to remind, again, as we continue to move toward the fall and the reopening and return to our school environment, I keep coming back to our recovery is in our hands, literally, and in our face masks, literally. These are simple things we can do. Are they inconvenient at times? Oh, yes. How many of us have forgotten as we head out the car door, I don't have my mask. Where did I put it? Put it on. Remember that you're protecting not only yourself as a source that can infect others, but also from breathing in from others. Frequent hand washing. We can't say it enough. 20 seconds, frequent hand washing. This is the time. I know it kind of gets lapsed. It's kind of hard to remember to do that as you move out. Social distancing of at least 6 feet, even when you're outside. If it's not part of your household, maintain that. That doesn't mean that you have to get in someone's face. You can step aside, you can wave, you can smile through your mask. People can see by your eyes your expressions. But it becomes important. These are simple things we can do until we have a very effective medication that can treat everyone and prevent them from needing any hospitalization or a vaccine. And right now, that's a ways off. So please continue to do what we need to do to maintain Illinois in the place where you can travel and visit. And we need to continue to do the hard work that all of our businesses and all of you as the residents and community has done since March. And as we look toward it, when you think about it, We don't want to step back on all that work and all that staying in that we did, all the hardships that our businesses, our families, our children, our schools suffered during this time frame. We need to continue to our due diligence on this. So with that, I'm going to turn it over to Mayor McNamara.
Thank you, Dr. Martell. I think the reason we leave it to the public health experts is because even on their break, they're reading about this. So thank you for watching out for all of us. There is certainly cause for concern when you look across the country, when you look at the state of Illinois, and I too am concerned. We're seeing many states and many major cities moving in the wrong direction in this fight against COVID-19. Here in Illinois, we've made progress. We've moved to phase 4 because we work together and we've been incredibly vigilant. If you just take a quick glance across the country and you take a look at several different states, you can see that they're moving in the wrong direction and exactly why we need to be more vigilant. You can look at Florida. Just this weekend, they had a single day where they put 15,000 new cases in a single day, positive cases up. That's the most of any state since we've begun this pandemic. You can look at Texas, where they have more than 10,000 people being hospitalized and being treated for COVID-19, with 600 of those in the ICU, and that's just in the Dallas-Fort Worth area. You can look at Nevada, which tried to jumpstart its economy and its businesses, has now tightened the restrictions for the second time since it's moved to reopen their state in early June. You can look at our neighbors in Wisconsin, have seen 3 straight days of record-setting positive case counts. In Dane County, they just put in force a face-covering ordinance for anyone over 5 years of age. Those are some examples that I think all of us really need to pay close attention to. The numbers in Illinois are also somewhat cause for concern. Dr. Martell just announced 55 cases here. That's a strong increase from what we've been seeing in previous days. We had just under 960 cases announced here in Illinois on Sunday. We had 3 days of over 1,000 cases being counted, being positive for COVID-19. This is the highest 7-day average we've seen since the beginning of June. I think I'm confident, and I can speak for everyone in our region, everyone in the city of Rockford and Winnebago County, we don't want to go where these other states have been and where they're going right now. From the start, we said, as difficult as it is to hear, this is going to be a marathon. This is not going to be a sprint. COVID-19, as Dr. Martell said, is here until we find a vaccine. It's not going to go away because we're tired of it. It's not going to go away because Tom McNamara gets frustrated after he puts 2 kids in this vehicle, which takes far longer than it should, and then you realize that you forgot your mask and you have to go all the way back in, take the kids out, and bring them back out. It's not going away because it's going to inconvenience our days. We knew back in March this was going to be a long and incredibly difficult journey. At the city, right now, we're continuing to work with our residents to help them with their mortgage payments and pay their utility bills. We're continuing to work with our businesses so that they can continue to have their lights on and pay their staff members. But rest assured, we do have long days ahead of us in this pandemic. So while we're seeing these signs of progress, we keep saying the same thing as we continue to come here. We have to remain vigilant and understand what allowed us to progress to this phase 4. And it's simple things when you think about it. It's wearing the face covering, it's washing your hands frequently, it's bringing things outdoors, as Dr. Martell said, and it's practicing social distancing at any place that you possibly can. I'm urging citizens. We collectively have sacrificed. Our businesses have sacrificed. Our residents have sacrificed. Our frontline workers have sacrificed. Please, do the simple things. Play your role in our continued fight against COVID-19. Wear the face covering. Wash your hands. Practice social distancing. Wash frequently used surfaces. And as Dr. Martell said, take your events and your gatherings outdoors whenever is possible. With that, I'll turn it over to Dr. Martell for questions.
Mayor, I actually have a question for
Yeah.
you first. You've obviously worked closely with local businesses, and you know how difficult it was for them to come back just from closing once. If we did need to go back, what would that mean for them? We've already seen a couple restaurants have to close temporarily now.
So I think each, good question. The question is, we've went through a difficult time, and make sure I get this right. We've went through a difficult time period. Businesses have had to sacrifice. I'm in contact with a number of businesses. If they have to roll back and they have to close their operations or reduce operations, what does that mean to them? Is that right?
Mm-hmm.
So I think it would be devastating for them. I think it would be devastating for their employees. I will say, and I won't speak for anyone else, it's been interesting to see the change in my own inbox from people who are writing me. Early on, it was a tremendous frustration that things were closed down. Then it became, I will be the most politically correct I can be and say tremendous frustration that they have to wear a face covering. Now it's business owners and employees saying, why can't these citizens who wanted us open so badly just do the very basic things to keep our doors open? And so it's a frustration on everyday citizens and customers not doing those basic things. I think it would be devastating to those business owners, especially the small locally owned business owners. They went through something we'll never, well, I hope we'll never see again. And to ask them to do it twice, I think would be incredibly difficult. We've lost some businesses already, and I think we would see an increase in losses of business.
This question may be for either one of you. She talked about travel procedures, going to states that may have higher cases. What does that look like for people who may end up traveling to California and coming back? Can you just describe that a little further?
So I'll let Dr. Martell talk about like the average citizen. I can tell you at the City of Rockford, we are following the CDC guidelines in the areas of concern, following Dr. Martell's guidelines, but we're also taking a look at how is our employee traveling? Where are they staying? Are they staying in a cabin, or are they staying in a 500-bed hotel room? So we're trying to take into account as much of that information as we can, try to inject as much common sense but also caution as we can for our employees. But specifically about California, I'll let Dr. Martell complete.
Well, I believe any state in general, any one of those high risk states.